the first appointment, what do we do in the first appointment with calcium therapy? Well, the first thing you got to do is what's going on? Find the facts of the issue. It's like, what's up, doc? What's going on in my mouth? Got to know. Well, a great way to begin is to try to test some teeth, especially teeth that we know are very likely involved with this issue, whether it's up in the front or in the back. And there's a lot of ways of testing things. And one of the most accurate ways of testing for vitality is this tooth alive? How much alive is this tooth? Is called a cold test taken with what's called endo ice. And any dentist that does root canals usually has this, and dentists who don't do a lot of it, they'll have it too in their office. Ask for it. So we do those tests and we find out, wow, this tooth is alive. Second thing we might do on our first appointment is equilibrate the bite. See how the teeth function and mesh together, and see how that force of your bite is distributed around the mouth and on what teeth, and whether it's on dental work or on real tooth structures. That tells us a whole lot about it. And these are hard, cold facts. X-rays. You know, X-rays have become really great, high-tech X-rays. But you know what they also are? They get to be scary. You know, you look at some of these, it's called cone beam or CT something. They're actually scary. You look as if like you're a skeleton sitting there. Well, you can't figure that if you take one X-ray of one kind, it's necessarily giving you the right view. Because you can take an X-ray like this, and that's what it looks like. But in reality, it's like this. You see? That's an entirely different view from this to that. So you have to figure out, well, let's see, what's going on here? What's our history of X-rays? What's different for history of root canal? The facts. And then we take those facts and we make an educated guess. That's right. It is an opinion. It's not really the facts. If you want to get facts from patients, start asking them questions. And patients, when nobody's asking you questions, are they really getting to what you feel, what your instinct is? Because patients have that feeling that, I don't know what it is, but it's somewhere here, doc, and it's hurting me up here. Well, those are real, and we dentists do the same thing. We have an instinct. You do enough root canals in your practice, you have an instinct that this is what's going on. And the tendency with highly educated people like dentists or physicians or lawyers or cement makers or layers is to get an instinct of what's going on here. I think that needs a root canal. And not act on it. What we do is we analyze it. Well, if I do this, I'll do that, or do this, or do that, then I have to do this, and then. No. Do a crossword puzzle, and you'll find, take a test, and you'll find that first instinct that you have is most likely most correct. And that's what we're all about. First appointment, put things together so that we know and the patient knows what we need to do, and so you go about doing it. You don't do a root canal, you fill it with the filling. Pretty nice, huh? This is Mark Manhart on calcium therapy. Thanks very much for coming.